What comes to your mind when you hear the words sexually transmitted infection? Most people think of rare, highly visible conditions. But today, we are talking about human papillomavirus or HPV.
HPV virus.
HPV.
The HPV virus.
HPV is actually a group of more than 200 related viruses, and it stands as one of the most common STIs worldwide. In fact, most sexually active people will contract HPV at least once in their life, while some strains cause simple skin warts on our hands and feet. About 40 types specifically infect the genital area, mouth, and throat, which could cause painful, itchy, bleed, or swollen glands. These are broadly categorized into two types: low-risk strains, which can cause warts on and around the genitals and anus in both women and men, and high-risk strains, which can lead to serious health complications, including cancer.
Hi, I'm HPV high risk type 16 and 18.
Hi, I'm HPV low risk type 6 and 11.
I can increase the risk of cancer if the infection persists. For example, cervical cancer, which will stay in the body for a long time.
I can cause genital warts but don't cause cancer.
So, to remember,
Low risk warts may appear.
high risk cancer, we fear.
One of the biggest public health challenges with HPV is that the majority of infections are completely asymptomatic. According to WHO, many people spread the virus unknowingly because they display no signs of infection. In most healthy individuals, the body's immune system naturally clears the virus within 1 to 2 years without any lasting effects. However, when an infection persists, problems arise. The key risk factors include increased exposure and vulnerability, such as having multiple sexual partners, since HPV transmitted by skin to skin, having a weakened immune system due to conditions like HIV, or a lack of human papillomavirus vaccines.
Wait, so even without sex, people can still get HPV?
Absolutely, yes! It doesn't require fully intercourse. It spreads through simple skin-to-skin contact in the genital area.
One common misconception about HPV is that it only affects women. In reality, HPV can infect both men and women, and many people do not experience any symptoms. When a high-risk HPV infection persists, it can cause abnormal cell changes that may develop into cancer. It is the leading cause of cervical cancer in women and can also cause anal, penile, vaginal, vulva, and oropharyngeal, which is throat cancer. According to the case study by Pinkiewicz et al. In 2022, a male patient was diagnosed with HPV-related oropharyngeal cancer, despite having no obvious symptoms before diagnosis. This case reminds us that HPV is a health concern for everyone, regardless of gender. Therefore, vaccination, early detection, and regular screening are essential to reduce the risk of HPV-related disease.
Meanwhile,
Teacher, can HPV transmit to oral sex?
Yes, HPV can pass through oral sex, but it doesn't happen every time.
To truly understand HPV, we must look beyond clinical biology and apply a biopsychosocial lens. An HPV diagnosis often carries psychological suffering, marked by internal guilt and a severe fear of social stigmatization. Patients frequently experience stigma-related anxiety because of the virus status as an STI, which drives self-imposed isolation and strains interpersonal relationship. Crucially, this psychological trauma creates a dangerous feedback loop. The chronic stress and anxiety caused by social stigma can actively impair immune function, making it much harder for the body to naturally eliminate the virus and accelerating clinical progression. Public health approaches must integrate mental health support alongside medical treatments to break this cycle. Currently, there is no specific antiviral treatment to cure HPV itself. Medical care focuses purely on managing the condition it causes, such as cryotherapy or surgical removal for genital warts, and procedures like LEAP to remove precancerous cervical cell. Therefore, proactive prevention is our strongest weapon. The HPV vaccine is exceptionally effective when administered between the ages of 9 to 26, ideally before any sexual activity begins. However, because the vaccine does not protect against all strains, it must be paired with regular cervical screenings starting at age 30,
as recommended by WHO.
Innovative options like self-collected HPV testing kits allow women to discreetly screen at home, bypassing traditional barriers, while consistent condom use remains a fundamental safer sexual practice.